I'm Kelanie, and this is my son, Theo. Theo, say hi. So my son has chronic ear infections, and he also, first starting out, just like as a baby, would have some stomach issues. So a lot of my friends also had children with stomach issues, and they would have colic for a long time. I wanted to get ahead of that, so I came in for adjustments for his ears, but also for kind of his digestive and belly stuff. So obviously we try to be really natural with him, just because, you know, that's the way we decided to go. And there's not a lot of things that the medical community will do for that besides put them on an antibiotic, but there was nothing really keeping him from that happening. And he's in daycare. Itsy bitsy. He's in daycare, so he's kind of exposed to a lot. And we wanted to just make sure that we were doing everything we could to prevent that. Instead of putting him on an antibiotic, they adjusted, you know, his head and his neck area to get all the fluids that were backing up in his ears to drain naturally, instead of that sitting there and then, you know, becoming infected. And then as far as his belly goes, the same thing, just making sure like his yes, that's a light. Just making sure that his guts were good and his, you know, everything was, you know, getting out of his system the way that it should. And instead of, again, just putting him on a laxative or some type of enema or something like that, that just, you know, doesn't really solve the problem until it's already a bad problem. So really just like preventing all of that from happening was really important to us as well. Staying on top of it so we weren't just reacting, we were being proactive, was really important to us as well. So I would recommend this place to anybody, I mean, obviously of any age, but specifically anybody. You want to go? Okay. But specifically for anybody with children who are dealing with the same issues. They have chronic spit-ups, or their bellies are always hurting them, or you can tell that they're just uncomfortable, but there's nothing that the doctors will really do for that. And then, so yeah, I would just say that any little issue you're seeing with your son or your daughter or yourself, it's just nice to get that checked out and really get ahead of it, because it makes your life as a mom or a dad so much better, because you're sleeping more, they're eating better, you know, they're happier, so you're happier, which I think is extremely important. And then they're happier, they're more comfortable, they don't understand why their bellies hurt or why they're spitting up. It's uncomfortable for them too, so making sure that you're getting them healthy and feeling good, I think it's important.